In today's discussion video, we're going to be talking about ethics, which is the main core value in the current 431 class that we're doing. Ethics refers to all of the rules that are accepted by a group or culture. In the medical profession, nurses are held to a standard and a code of conduct that we are expected to uphold each day we practice at work. Nurses should make ethics a priority, and they should really use ethics to direct all of their care and where they are leading and directing their patient. The code of conduct that should be upheld is to provide the best moral decisions for each and every patient and ultimately provide the highest standard of care, and most importantly for each patient regardless of where they are from. The principles of ethics include autonomy, justice, benefits, and non-maleficence. Autonomy refers to the patient's capacity to make their own decisions for themselves, regardless of how we feel or how their family feels. Although I feel like we run into a lot of ethical dilemmas with family persuading the patient to do something other than what their heart really tells them to do. So it sometimes puts nurses between a rock and a hard place of what we should do and what's best. Each patient deserves to have the right to make their own decisions with their free will. I think it is our job to make sure that we educate and provide them with anything that they need to know about the decision that they're making, but it is not our job to judge the decision that they are making. An example that I think that we run into often is patients switching from full care, full code to DNR, DNI, or comfort measures. It's often that the family is giving them pushback, but it's very important for us to be morally correct to say, this is what happens, this is what a DNR, DNI is, and if you're ready for that, this is what we will do, this is what we won't do. And that's just us giving the best standard of care for holding out that patient and if life wishes. The next is justice. This principle just holds nurses to being consistent and fair regardless of where the patient has come from, or their economical background, how they look, if they're a previous drug user. With right now, that's a huge epidemic in our society in the Mid-Ohio Valley. We have an abundance of drug users. A lot of them are in recovery, a lot of them have relapsed, and a lot of them are never going to recover. But it most definitely is our job to ensure that we are consistent and fair with every patient that we have, regardless of where they're from. And again, it's not our job to judge from looks or how they act. And this just provides justice to everyone. Next is benefits, and that is the general principle to do the most good for your society. This includes always thinking of their pain, physical and mental health that they're suffering from. And I think the biggest thing with benefits in our profession is advocating for the patient. We are the biggest advocates, and that is what it comes from. If your patient is having post-op pain and it's breakthrough pain, you want to message that physician and say, hey, this is our patients. I'm advocating for my patient, they're having pain, and we need to do what is going to be in the best interest, which is get something else for that breakthrough pain. Next is non-maleficence, which is the principle of doing no harm. And I think this also plays a really big part in our profession because we are constantly double checking. We're double checking for med errors. We are double checking to make sure that we are not doing anything that could potentially harm the patient. This is why we have implicated double sign-offs for insulin, for cardiac meds, anything like that, titrations. Understanding these principles helps the nurse provide compassionate and morally responsible care for every patient that we come across. Ethical decisions are made every day, and we should be using these principles to help shape, guide, and direct the decisions for our current patients and our future patients that we will be taking care of at the bedside. Ultimately, ethics is the heart of nursing, and it allows us to give the best care possible for everyone.